Good morning, EVSL Live. I'm Emily Luke, and it has been a remarkable week. Today we're going to be focusing on a rare disease called congenital insensitivity to pain and anhidrosis, also known as Cipa. Cipa is a rare hereditary disease that causes affected individuals to be unable to feel pain or sweat because they cannot feel it between extreme temperatures. Cipa is caused by a genetic mutation which prevents the formation of nerve cells, which are responsible for transmitting signals of pain, heat, and cold to the brain. The disorder is autosomal recessive. Today we will be talking about two different types of stories that have been happening recently correlating to Cipa. Our reporter Vivian Lee will fill you in with all the specific details concerning with Sabrina Singh's life dealing with Cipa amongst her brothers.
Thank you, Emily. Currently, I am at Sabrina Singh's house in order to investigate the effects of Cipa on families and young kids alike. Many victims of Cipa have shown to have thick, leathery skin, which is known as lichenification, on the palms of their hands. They may also have misshapen fingernails or toenails. Almost half of the people suffering from Cipa show signs of hyperactivity or emotional instability. There are also people who have shown to have an intellectual disability as well. Studies show that people with Cipa have weak muscle tone when they are young, but can normalize as they mature. So now that we have some background information, let's go check out the house.
I am the sister of my two little brothers, Peter and Josh, who have been diagnosed with Cipa since they were 5 years old. Peter is 13 and Josh is 11. They have been dealing it for a few years and it has been a hassle. My parents have been struggling ever since my little brother's been diagnosed. And in and out of hospitals with 3-month readmission and in hospital complications, we visited various doctors that have told us information about Cipa, which seems so dreary and difficult. And the hospital bills have been so expensive.
So, would you mind sharing how Cipa has affected your brothers?
My brothers usually heal slowly from skin and bone injuries. Repeated trauma can lead to chronic bone infections, which can be severe depending on how it happened. Bone and skin infection can cause limitations to my brothers because they can't feel their bones, so they can't tell us if anything hurts unless we go to the doctors and get them checked out properly.
I can't imagine what you've been through, Sabrina. However, I have a few questions that I would like to ask regarding Cipa. Are there any treatments for it? Or how does it affect your brothers' lives? And is it hard for your family?
Yes, it's been very tough for my family and I. It hurt to see my brothers go through many treatments and having in and out hospital trips every week. It was hard when they were first diagnosed, but as they grew, they understood the severity of this rare disease. Currently, there is no treatment or cure for this awful disease because of how rare it is. The only treatment we can do for them is controlling their body temperature, preventing self-injury, and treating orthopedic problems. It's very important to control the body temperature during any type of surgery and watching them when they are sick.
Thank you again, Sabrina, for letting us interview you and your brothers. It must be really hard not knowing what your brothers feel on a daily basis.
No problem, and thank you for hearing my brother's story.
No problem. What was that? Peter? What'd you do? Josh?
Nothing. Even though they both look hurt, they both also have a smile on their face.
Come on.
Because of Cipa, neither of them feel the pain. As you can see, Cipa is the extraordinary inability to feel pain and temperature, which often leads to repeated severe injuries. Unintentional self-injury is common in people with Cipa, typically biting the tongue, lips, or fingers, and can lead to spontaneous amputation of an affected area. Normally, sweating helps cool body temperature, but the anhidrosis of Cipa often causes recurrent, extremely high fevers, and seizures brought on by high temperature.
Thank you, Vivian. Although Cipa has been reported worldwide, Cipa is extremely rare in most populations except for the Japanese and Israeli Bedouins. In 2009, the number of Japanese with Cipa was estimated between 130 and 210 people. If you are unsure as to whether or not your child or loved one has Cipa, there are certain tests to diagnose those people suffering from the disease. Skin tests demonstrate abnormalities in sweating and the lack of axon reflex. There are also skin and nerve biopsies, which are used to confirm the diagnosis in the past. However, molecular genetic testing is now preferred. It's best to get your child diagnosed once they show any symptoms mentioned because there are so many limitations due to Cipa, such as bone decaying and infections leading to the bone. However, there are many costs of having the disease. The hospital stays are usually lengthy. However, there are 3-month readmission and hospital complications. Not to mention there is always a possibility of death. Likewise, the quality of life questionnaires EQ, 5D, 5L is being collected for all patients at hospital admission and discharge. Rest assured, there has been plenty of research on how to find a potential cure to Cipa. Research shows that tropomyosin receptor kinase A is the main nerve growth factor receptor involved with mutations. These were assumed to be double and triple mutations detected in consanguineous homozygous patients from the United Arab Emirates and Italy by screening the entire coding region of TRK. Pain is also associated with abnormal skin color, temperature change, abnormal pseudomotor activity or edema. The pseudomotor system is innervated and regulated by the sympathetic nervous system and nociceptive. Sympathetic neural pathways are supported and maintained by the neurotrophic action of nerve growth factors. Availability of a viable therapy could specifically inhibit these pathways.
Thanks for watching EVSL Live. Tune in next Wednesday at 6 p.m. Eastern Standard Time for another episode. Now here's a few fun facts to conclude this segment.